Hi, I'm Dr. Christian Allard, Doctor of Chiropractic. I'm the Managing Director of Proback Clinic Victoria, so that is in London. Here at the practice we do spinal decompression, we do shockwave, we also do radio frequency, laser therapy, we have our own X-ray suite. And today we're going to be speaking about Prolozone, which is a new technique that we've been doing since 2024. So Prolozone is a regenerative medical technique, so it's an injectable technique. So what we actually do in any areas that are painful, for example, for back pain, neck pain, for joint pain like knee, ankle, shoulders, elbow, we will inject ozone in those areas. And why ozone? Because ozone is very powerful oxygen. So if we take oxygen and ozone, oxygen is O2 and ozone is O3. So when we inject ozone, which is O3, it will dissipate and get absorbed by the body about 10 times better than oxygen, and therefore will actually reach the area that we want to reach that very often have very little blood flow, and will encourage the healing of that area. So the pros for Prolozone, obviously the first thing, it's a lot less painful than most of the injectable techniques like either hyaluronic acid, either prolotherapy or steroid injections as well. So a lot less painful. It's very safe as well. So we don't have to use very large or long needles. We can use much shorter needle, and then the gas, when we inject the ozone, the gas will dissipate and reach the area that we want to affect. One of the questions that all patients ask us is how long does it take? How many treatments does it actually take? Now with Prolozone, it's relatively quick, but we always have to give the time for the body to heal. So therefore, the average treatment will be about 5, but it's anywhere between 3 and 6 treatments. And the time between the treatments is anywhere between 1 week initially to about 2 weeks as the treatment goes along. So usually within about 8 or 9 weeks, we can actually have really good results with most patients. So one of the most conditions that patients actually come to see us with is ligament injury or ligament pain. So the pain could be coming from, obviously it could be coming from the bones, the pain could be coming from the discs, could be coming from the joints, so we've got the posterior joints, from the nerves as well. Could be coming from the muscles, from the tendons. But if the pain comes from the ligaments, then it'll be very difficult to diagnose because ligament injury cannot be seen on the MRIs. Now, when people have what we call referred pain, now what referred pain is, just imagine this area being unwell and inflamed. This will send the signals to the spinal cord, and the signal will be so strong that it'll overflow, and the same level will actually make us feel the pain down the leg. How do we actually diagnose ligament injury? So the way that, or the mechanism of injury of a ligament is going to be very specific. This area here is filled with ligaments, and we can see this area here has ligaments going there, this has ligament going here. So if you stretch those ligaments either too quick or further than what the ligaments can be stretched, the ligaments will get injured, and that'll actually be painful. So those ligaments will become unstable. It's almost like having, screws on your wheel. You drive your car and the screws are like, they're not tightened properly. It's not going to drive well. So unless those ligaments are actually treated, or unless they actually they're healed properly, that patient will remain in pain for a very long time. So one of the real challenge that I find as a practitioner is patients will actually use MRIs, and they'll actually think that MRIs will tell them the whole story. Now, the big problem with MRIs is, and it's been tested, there's research on it. If we take MRIs of 100 people that never had back pain, not even 1 day, not even 1 second, we would expect none of those patients to have disc bulges. Okay, so that's what we would actually assume. But it's very much the opposite. So they found that out of those 100 people that never had back pain, 95 will show disc bulges, yet they have no back pain. So thinking that those disc bulges are the source of the pain could be quite misleading. So with patients that have a lot of inflammation and everything has a lot of scar tissue, Prolozone or ozone injections will reduce the inflammation, but will also allow the tissue to have oxygen. So the more pain you have, most of the time, the more scar tissue or fibrous tissue you have because you've inflamed it so many times or you injured it so many times. So Prolozone will allow those areas to get fed and to have that oxygen that's essential for healing. Thank you for watching, and please press the like button. If you have any questions, please contact us. We'll be more than happy to help you.